I am coming to you live from Jinja, where duty has called me this morning. Now, yesterday, Minister of Health confirmed the first Ebola case in Jinja district. In an official tweet by Minister of Health, that's Dr. Ruth Acheng, as he tweeted that Jinja had confirmed the first Ebola death case. When you look at the deceased person, he has been identified as a 45-year-old Daniel Waswa, a resident of Kayalwe village in Bulongo Parish, Buyenge Town Council in Jinja district. This was deceased who was also a contact person to a victim who had succumbed to Ebola earlier on. Now, since yesterday, the district surveillance focal team has already started contact tracing from the village where the two deceased persons were buried, and also the facilities where they were first admitted after presenting some illness, with hopes that on suspicion that the late who passed on Friday, when he was first admitted, according to the health officials, when he was first admitted in the private clinic, there was suspicion that maybe he could be having typhoid. But later on, when he started presenting some signs like fever, diarrhea, stomach pain, and sore throat, he was later on referred to Buyenge Health Center 4, where he was admitted, and that's where he passed on. So since yesterday up to this morning, according to the district surveillance Mubaye, when I was speaking to him, he confirmed to me that since yesterday up to this morning, they have been able to trace 40 contact persons who came in touch with the deceased. And out of the 40 people who have been traced, 4 are presenting similar signs and symptoms like the one of Ebola. So this is the development here. Already 40 people have been traced, and the district health team is continuing with the tracing of these people in the villages and town council where the deceased persons were buried. Now, when you look at this deceased, he's a contact also to a victim who had earlier on succumbed to Ebola. This was a victim who was from Kampala, so he came to Jinja where he passed on. So the deceased who passed on Friday was the person who was taking care of the victim who also succumbed to Ebola. But however, something that I've also seen very challenging in Jinja Hospital when I visited the hospital yesterday is that despite the confirmed case, the level of alarm, people seems to be normal with everything. And even at the hospital, you can hardly see any isolation center that has been established. And that is a question that I was able to pose to the district surveillance focal person, who confirmed to me that yes, at the moment, they don't have any isolation center that they have established to put these contact persons who have been traced. But however, he also confirmed to me that by today, they will be in position to establish an isolation center where these people will be put. Plans are underway to evacuate these 40 contact persons who have been traced in the village where the deceased person has been buried. Of course, when you look at this virus that Uganda is battling with, this is the Sudan strain that has no proven vaccine yet. And according to Minister of Health statistics by this morning, the country has so far registered, that is a total of 138 confirmed cases, with with 68 recoveries and 54 deaths ever since the virus was first registered in the country. So this is the developing story that I'm trying to follow to see how the day goes by. At the end of the day, I tend to speak to the RDC, the district surveillance focal person, and also the hospital admin to find out what mechanisms are they going to put in place to ensure that the patients and those who are taking care of them are very much safe from this deadly virus.